Welcome to the Phoenix Prosperity Podcast, where wealth meets legacy. Join your host, Tim Fergestad, as we explore the journeys of Phoenix's finest to success and beyond.
Hello, this is Tim Fergestad. Thank you for joining us. I'm very pleased to have Beth Schleeper with me here today. Beth is a medical billing and coding expert and the owner of Advanced Coding Services and Education and Training Company. Welcome to the show, Beth.
Thanks for having me, Tim.
That is a formidable focus in this day and age. Can you tell us a little bit about how you got that job?
Well, quite frankly, I started billing and coding 20 some years ago. I tell people I started when I was 2 because I'm not yet 30, right? So I've been doing this for a very long time, and it's truly my passion, and I love it because I really enjoy seeing the doctors. It's all about medicine, and it's the business side of medicine.
Okay.
But it's very validating to see the claims that we've submitted get paid.
Okay. People get the care that they need and get
exactly. The patients are getting what they need, but my doctors are getting paid for the services that they've rendered. And
Okay.
and that's very validating to get that check back in the mail.
Sure.
I started a long time ago, quite by accident, because I was a receptionist for an internist in North Scottsdale, and the office manager and he had a falling out very shortly after I started. She
You got
left.
promoted.
It was me. And he goes, "Do you know anything about billing?" And I said, "No." And he said, "Okay, well, I'm sending you to classes. You're going to learn." And I said, "Okay," because education is yours. Nobody can take that away from you. So, okay,
Right.
I'll learn. And I went and started classes, learned about billing and coding. And at a point, he and I kind of had a parting of the ways. And I decided I was pregnant with my son, and I wanted to be a stay-at-home mom, but I needed to work. And so my dad and I opened T&T Consulting, and that was 28 years ago.
Okay.
And
So you were able to start doing the coding services remotely?
yeah, so it's an actual billing. So it's an actual revenue cycle management company, T&T Consulting. We do all of it from the get, from end to end. And it was back in the day, where it wasn't all electronic yet. Like I'd have to go to the doctor's office and get the stack of their EOBs and their super bills, manually enter everything. Yeah, I mean, I had my days of where I'd go to each practice and get their stuff and bring it back, and then you'd have to manually key everything in. So it was a chore, but it was back in the day too, where it was frowned upon for a business to run out of a bedroom. Now people work from home all the time. It's kind of funny to look at this where we've come full circle. But so we rented some office space to give us credibility of, yes, we're not those people that just run out of our house. We have an office and we're a legit business, and we
patients' files are on the kitchen table.
Right, exactly. Exactly. So and we've been doing that for a while. We've been doing that for 28 years now. So
okay, excellent. And I'm sure there's some great things about it. You mentioned there's also a lot of pains in that industry, a lot of changing of the rules and complications and hurdles that the different providers throw in there. So kudos for navigating all that, by the way. Can you talk a little bit about what's been the biggest hurdle?
Well, to quote one of my industry friends, Christine Hall, she says the one thing in healthcare that you can count on is change. And I think that we exemplified that wholeheartedly when COVID hit. For us in the billing and coding side of this, on the clinical side, the doctors were figuring out how to treat COVID. On our side of it, everybody was going remote, and we were trying to bill for remote, and how do we code for this, and how do we we had guidelines that changed hourly, some of them within minutes. And so we had to really get our guidelines, timestamp them, and save them so that if we ever got audited on what we did today at 9:13, we had this guideline that we followed, because by 10 o'clock, that guideline probably changed. And so you had to know what you were doing, and you had to keep your documentation straight. And so it was just a flurry of activity. And now that we're unwinding the COVID stuff, and the PHE has ended, that public health emergency ended a couple years ago, we're still dealing with Medicare, and are they going to cover telehealth services or not? And do our commercial payers cover that or not? And who covers it, and what is expected within that visit if they cover it? And so it's still it's a never-ending change in healthcare and the business side of it.
That sounds it sounds tough, because like most of us, we want to look forward to what's next and grow and do the next new thing, and to have to be constantly dragged into something that's already happened sounds annoying as heck. But can you share a little bit more about that? Because I think everyone might find that interesting. Is how frequently are offices audited, and by who?
Well, so it's not if you'll be audited, it's when.
Okay.
And audits, medical audits look different. Okay. So let's say that we see you today, and I send your claim into the payer. The payer might send me back a letter that says, hey, I see that you saw Tim today. Great job. Hey, we want to see your documentation before we pay that claim. That's the start. That's an audit. That's a prepayment audit. Okay. So some of that happens. And if that's starting to happen with a provider, you probably want to start looking at your documentation. You want to start looking at your coding and your billing, because they're already starting to audit. Okay. Sometimes audits are on the post-payment review. Hey, you saw Tim 2 months ago. We've paid you. That's great. Hey, we just doing a post-payment review. We would like to see your documentation. That's on the backside. We've already gotten the money, but now they want to see our documentation to make sure that they paid the claim that they were supposed to. Okay. So we have to send in those medical records as appropriate to substantiate our charges to them. And that's an audit. But then we also have those audits where you have been committing fraud. We know this, and we're going to come in and have a little conversation. And that's usually Medicare, Medicaid, TRICARE, your government payers, because those are funded, Medicare, Medicaid, and TRICARE. Those are all funded by your taxpayer dollars. And so they're very, very cognizant of making sure they know where that money is spent, and that they're paid claims that they were supposed to have paid, and that there was no fraud. And so by the time you get to them, they've already established a case.
Okay. So I guess I imagine a lot of the fraud comes from
bad actors.
Well, yes, but I mean the nature of the industry now to document all this stuff is through third party, sort of maybe electronic medical record companies. So they have some sort of independent means of logging all this. Is that kind of how that came around?
Well, the provider is still responsible for all his documentation.
Right. But you could make those up, on your own. You could make up all sorts of papers and show that, right?
Yeah. Well, that's kind of the thing. So there's a hotbed of fraudulent activities, and typically it's in Florida and New York, just kind of on the East Coast, because there's a lot of retirement communities there. And some people might go, they might just like have a job fair, or they might have a healthcare fair. Hey, show me your Medicare card and I'll give you a free, oximeter test or whatever. Well, you give them your Medicare card. Now they have your Medicare information, and that's how they get the legitimate information for patients to then commit fraud.
Okay.
Or maybe they're upcoding or downcoding. That's usually not a fraudulent activity. I mean, that happens. If we know it, if we're noticing a pattern, that's fraud. But fraud is the intent that we have intentionally lied, or that we've intentionally upcoded or downcoded in an effort to get more money.
Right. Okay. So my wife is a physician, and I know, particularly when she was doing pain management and stuff, that it was very difficult to get approval for care and stuff and pre-approval, and
Right.
she would have to spend so much of her time on the phone trying to prove to somebody who's not a doctor that
Right.
what she's saying is appropriate, and she said, "Why do I have to argue with you? You don't know what I'm talking about," type of thing.
So, so my advice to her at that moment would be, I want a peer-to-peer review.
Right,
And if you're not a pain management specialist, we are not peers.
right,
And I want a peer-to-peer review, which means I need somebody who is specialized in pain management. That's who we will talk to. Otherwise,
right,
I'm just talking. If she's talking to me, I am not clinical, but I have a little
right.
script that tells me what I can and can't do. That's not a peer-to-peer. So she needs to have a
Sure.
peer-to-peer review.
But even to get that peer-to-peer call in the middle of
Right.
her day when she's trying to see 30 patients in her clinic and stuff, and it takes like an hour and a half just to get that peer on the phone for this and that, she's back and forth all day. That's just for one of her cases, right? It's just
It's one of her 30 cases that she
yes.
spent hours to do to get that claim paid.
Right. Well, trying to get it approved or whatever. Yeah,
Right.
it's never ending. It's a big quagmire. Very, very tricky
Well,
stuff.
there have been some great successes when you involve the patient,
Okay.
because the patient owns that contract. The
Right.
patient is who is paying their
Premium.
premiums on a monthly basis.
Right.
Listen, if I have a, let's say I have Blue Cross. If I have Blue Cross and you're treating me and I need a pain injection and you're not able to do that because my insurance isn't covering it. By George, I better be on the phone with my Blue Cross going, "Hey, why aren't you covering this? Because I need it." So
Right.
there's a lot of value in getting the patient involved to assist in getting that treatment authorized.
For sure. For sure. That communication process is there's different
Is a
players
lot.
involved and a lot of middle people, and it gets very complicated and drawn out. And that's when I think all the frustration happens.
Yes.
Um, let's back up again. So, at what point did you start training other people and teaching independent of your service providing as a consultant?
Right. So years and years ago, again, like minutes, right? Um, my dad and I were extern sites for big box coding and billing schools, and we would
Okay,
that was kind of our way to give back. We're
right,
trying to help the next generation of coders and billers, um, and we'd have these students come in, and they had no idea what they were doing, and I would be like, "Hey, let's look up a diagnosis code," and they would be like, "A what?"
right,
I so so we would have to have a lesson in how to use your, back then it was ICD-9. We'd have to have a lesson in how to use your ICD-9 books and how to look up codes in your CPT books. They didn't know what HCPCS books were, and so we had to go over the basics. And we did that a couple of times with a couple of students. And I remember one time it was just my dad and I at lunch, and we were like, he said, "I think we need to open our own coding and billing school to teach these students real life stuff because they're not getting that
right.
wherever they are." And I
Okay,
said, "Okay, I think that's a great idea." So that was just kind of on our business plan. Um, my dad died in 2012. And in 2015, I opened Advanced Coding Services. Advanced Coding Services was established. I purchased it from a lady who was retiring, and she just did the coding classes, and we took it on and we started doing the coding classes. We started doing billing classes. We have monthly memberships that coders and billers can subscribe to get resources, to get more help, to get more education. We also do retreats across the country as a way to network, because this industry is so large but it's so small. And it's important that your wife does pain management. Well, I might not know pain management, but I have a friend who's doing it and I need
right,
some help. Or I got contracted to do an audit for a pain management clinic, and I can do an audit, but I've never worked in pain management. So I have friends who I can call. And that's what we talk about with our networking, with our retreats, is building that community where we all know each other's weaknesses and our strengths so that we can build on that. But we really started the coding and billing school so that people could have a career. College isn't for everybody. So we have a vocational license through the state of Arizona where you can come and for 20 weeks you get a certificate of completion, and then you sit for your actual CPC exam through the AAPC, and now you have a career. And you're going to start at the ground level, but you have a career. And this is a way for people who college wasn't a choice for financial reasons or whatever, that they could still do this program and still have a career where they have self-worth and they have value, and they're feeding their family and they're taking care of their family. And that was really my intent, that they could do this. But then when they leave Advanced Coding Services, they can say, I got trained by Beth. I got trained by Advanced Coding Services. And that says something, and it means something in the community that they got the training that they needed
Right.
to be a successful coder or biller.
Excellent. How do most people find Advanced Coding Services? Are they on their own? Is it through some other clinics or something? They send them to you? Do you have affiliate relationships where as they bring people on, they say, go here first and get your training?
I don't have any affiliate relationships. So if you want to help me with that, I'm happy. Let's talk about that.
Sure.
But I mean, we have a website. We market on the APC website. That's who we purchase our curriculum through. I'm not teaching you something I've made up. This is actual curriculum from the writers of the CPC exam, from the CPB exam.
Right.
I'm teaching you their curriculum. But I'm throwing in almost 30 years of experience in here's what the curriculum says, but here's what real life is going to look like, kind of stuff. But we go through that. We have it on our website. We have it on the APC website. We have social media, Facebook, Instagram, LinkedIn. I'd love to connect with anybody on LinkedIn, Facebook, Instagram. Beth Schleeper, I'm on all those platforms. But then we also have Advanced Coding Services. They have their own platform, their own login, their own account.
Right. Okay. It just seems like I imagine a lot of the places do on-the-job training. They just sort of make them figure it out as they go, and they struggle and stuff. And I'm sure there's a cost to all the problems that occur that way and inefficiencies. But also the bigger places may have some sort of training as you come on a Brazo or Banner or something. But often it's cheaper to have a third party who specializes in it do it. And that's kind of where I was thinking you might be a good fit.
We talked about that your wife is a physician, but what if she taught you how to do her billing? And she taught you how to do her coding. You're a smart person, and so you could figure that out, but you're limited because she's taught you what she knows.
Right.
And if you don't know,
she's not a business person, she's a physician, right?
Right. If you don't know the full spectrum, if you haven't learned that foundation of why we do what we do and the steps to do it, yeah, you might, blind chicken gets a kernel, but you might get it right, but you also might create a very big mess.
Right.
And so, yeah, there's a lot of on-the-job trainings and that happens. But then you have those people who I'm just learning because that's how we've always done it. Well, how we've always done it can't be true because there's so much change in the last couple of years. How we've always done it isn't how we do it anymore.
Right. So back to the question on where do most of your students and clients come from?
I would say from social media posts, from word of mouth. That would be my guess.
Okay. Are they already working in the healthcare industry in some capacity and they want to go to the next level, or? Some
are and some aren't. Like right now I'm finishing a class, and I have a nurse practitioner in the class because she wanted to learn how to do the coding for her own practice. Okay. In that class, I have a brand new girl who has no idea. She just wants to learn coding. I have a realtor who had a life-changing medical experience, and so she can no longer work as a realtor. She wants to learn coding, so she'll still be able to contribute to her household. And I have a nurse practitioner. So I have those three gals in this class. So we have a vast array of coders. And so we get them from, websites, social media posts, word of mouth.
Okay. Can you talk a little bit about how this is changing, not just in the complications, that is the amount of services keeps growing and the amount of codes keeps growing, but also um, the technical aspects, right? And having co-pilots or AIs and other things try to simplify,
Right.
right, some of these processes, which I'm sure is one more layer of complication for
It is.
coding.
It is. So at the end of the day, right now, where we stand with AI, AI is helpful in selecting the code, but it doesn't have the mindset yet to select the appropriate code. Can it get me in the general direction? Can it get me in the right section of my book? It can, but it can't select the appropriate code yet because you still need that mindset. You still have to have that human interaction to connect that. Because my doctor might have said patient has otitis media, and I can type that in and I'm going to get a code. But wait, because somewhere down in the body of my note, it might have said it was left ear or right ear, but my AI didn't pick that up. So it's just giving me the non-specified code for otitis media. Am I going to get paid? I am. Is it not going to be clean? It's not. And so you still have to have those actual physical human eyes to look at those codes to select the correct code. AI, I will tell you, is very helpful recently with writing appeals or your demand letters.
Hmm.
If you're getting denials from your payers, talk to your AI, get that chat GPT thing going, and it'll write you an appeal letter. And the really cool thing is that once it writes that letter, you now have a template. You don't have to reinvent that wheel.
Right.
Um, and it'll do that. And you tell it to cite references, cite laws that say you can't do X, Y, and Z, because there are laws that say you
Right.
can't. And so you start pulling that out, and before you know it, instead of having the 2 paragraphs that I might have written on my own, I now have a 3-page document with sources and the laws that say why
Right.
you can't recoup money.
Okay. Excellent. Excellent. Um, okay. So back to the electronic medical records. Can you explain a little bit of that to which are the major electronic medical record companies out there and how that impacts your industry?
Well, so the EMRs, uh, they all have the same functions. They just look different. So are some better than others? They are. Are some worse than others? There are. Um, I personally love eClinicalWorks. It's very robust. It's also very expensive. And so it dots every I, crosses every T, makes you breakfast and kisses you goodnight if you use it appropriately. And that's kind of the thing is, are we using our EMRs as they're written, as they are intended to be used? If you are, then you're going to have a very robust program. Now, there are some that are very smaller, much smaller scaled EMRs or EHRs, for the one doc, 2 doc practices that don't have a lot of cash flow. And so, you get what you pay for, and that's not a dig. It's just,
Right.
if you're going to spend a couple $100 a month on ECW, you're going to get a very robust program. Well, if you don't have that kind of money, there are freebies out there, but you get what
Right.
you pay for. And so, but any of those programs, it doesn't matter. They're all as good as what you put into them. They're only as good as how you've set them up and what documentation or data you've entered into them.
How important are those for billing and coding?
Without the correct information, I'm at a standstill. So
Okay.
I can put your name in as Tim Fergstad, but let's pretend I accidentally put Tom.
Hmm.
Well, if I've accidentally put Tom and I'm billing it to Medicare, Medicare is not going to pay me. So I have to make sure that I have everything, every I dotted, every T crossed, that I'm very specific. Otherwise, I'm not going to get paid. And I might see you 6 times. And if I don't have a biller who's cognizant and is following up on those claims to say, these all got rejected, and why are Tim's claims being paid? For somebody to go back and go, oh, at the front desk, we called him Tom. And so we need
Hmm.
to fix that, change your name, get it adjusted on all of those claims and resend those claims. That's when I'll start to get paid. But if I'm not being responsible, if I don't have somebody to work my billing on a regular basis, those claims might sit there. And that's literally just money on the table that the provider is not getting. So it's important that we have all of the correct information in the correct places at the correct time. We have to have our correct diagnosis codes. If our diagnoses aren't correct, or maybe there's a new one this year, I'm using the old one from last year, but that's no longer valid. And so if I'm using an old code, my claim is going to reject. If I'm using an old CPT code or I missed a modifier, my claims might reject. And I have to go back and fix those. So it's important to get it right the first time so that the cash is flowing, so that I don't have to go back and fix all of these messes. And I would say once you find a mess, fix it, but then educate the front desk or educate the person who made the mess so that we don't have that mess again.
Right, right. Well, let's talk a little bit about how, well, as we wrap up here a little bit, we got to pick on physicians a little bit more. What are some of the challenges in working with smaller clinics that are run by a physician who's very well educated and knows their specialty really well, but the challenges in running an actual business?
So what I've told patients and family and friends is that if the doctor has a poor bedside manner, they probably are the best person or the best skilled physician for that specialty, right? Because most often our physicians are pretty focused, right? So if I'm working with a cardiologist, he could be the best cardiologist and have zero social skills. The problem is that when I'm dealing with physicians or small practices, the physician is very skilled in his area.
Mm-hmm.
But most of the time they're not businessmen.
They don't have an MBA, they have an MD.
They have an MD, they don't have an MBA. And they're trying to do all of those things because I'm an MD and I should know these things. And I love my docs, so don't anybody come at me with hate.
They're very smart overachievers, but you just can't know everything.
That's exactly right. But because they're so smart and because they've got that MD and they've gone through all these years of school, they think they should know everything. And the reality is that at the end of the day, you're human and you put your pants on just like everybody else. And just like I have weaknesses and strengths, you have weaknesses and strengths. And that's where we try to come alongside, and your coding and billing might be a weakness because that's a business thing. Like, don't ask me to go do an open heart surgery because no, just no. But then you should also be, I'm going to say, responsible or adult enough, and that's not the right word, so probably cut that out. But but you should also be cognizant enough to say that is not an area of my strength, and so I need to find somebody who can do that.
Right. And this is what keeps the clinic running, right? Is keeping the finances flowing. So incredibly important. Thank you, Beth. So I think next month you have an event, one of your events. Can you share that?
Right. So June 6th, 7th, and 8th, we are in San Diego, in beautiful San Diego. 6, 7, and 8. We're doing a retreat, and this is where, again, you just come together and you're going to have some education and you're going to get some continuing education units, so your CEUs. But this is where you're going to sit with industry standards or industry leaders,
right?
Where you're going to learn from them. But it's a small environment where we're all going to go to lunch together. We all sit together for breakfast. If you have questions, you ask it while they're doing their lectures. If you didn't get your question asked or answered during the lecture, that's when you walk with them to lunch. That's when you sit with them at lunch. That's when you hang out at night on Saturday night. We have shenanigans. We have Saturday night shenanigans. And this is where we play cards and just visit as people, not leaders anymore. Now we're just getting to know each other on a one-on-one basis, and just hang out. Because then at the end of the day, people are going to leave and they said, I sat with so-and-so. I know so-and-so's number, so if I have a question, I can call them or him or her. But we're building that community. We are networking and building that community because at the end of the day, I want to empower people to have the career that they want. That you're not just boxed into, oh, you're just a coder, you're just a biller. You are a biller, you're a coder with great resources.
You're a problem solver.
You're a problem solver. You know where to get the information. And it's not just you're on an island. You're not. Healthcare is not an island. There are so many of us. I'll tell you really quick. I have a friend who works at a big hospital, and she'll go to the hospital. She'll go to work, and she'll be like, "Hey, I'm gonna go do this, this, and this weekend." And they're like, "How do you keep finding these? Why don't I know them?" And she's like, "Well, it's my sister-in-law, who does all these retreats." But then she'll call me and she'll be like, "Hey, so and so wants to know how to do X, Y, and Z." Because she doesn't know where to find the resources. She doesn't know how to find this information. So she'll call me to get it. Well, I'm happy to help you, but like start attending some of these things to get your own education, because you're not an island. You're just not. There's a lot of us out here who have great information, the correct information, so that things are done correctly the first time.
Right. For sure. Well said, Beth. So providing value, solving problems, that's what it's all about.
Yes.
Okay, I have a reflection question as we wrap up here. It's what do you wish you knew sooner about building success earlier in your career?
I honestly wish that I weren't afraid of failure.
Ah, yes, the stepping stones to success.
Yes. Or conversely, afraid of success.
Yeah, that happens too.
Because
limiting beliefs, all that.
Yeah. What if I'm successful now? But then you also have that imposter syndrome, right? So if I'm successful, am I really successful? Do I really know what I know, or am I just pretending? And so, I would say the fear of failure or the fear of success. But I had I don't know if I can find it. Oh, I heard a quote the other day, and it said, "Don't fear failure, but be terrified of regret."
Yes.
And I thought, oh, that's a lot. I don't want to be on my deathbed and go, I wish I had done X. I wish I had done whatever. I'm at the point in my life, I think I don't want to fail, but I'd rather fail than regret.
Yep, for sure. That's a great answer. I've known a lot of really successful people, and they all have failed repeatedly, and that's not being afraid to go out and try. But to your point also, I think there's a really good book, I forget who the author is, Regrets of the Dying, with interviewed a bunch of people, and none of them regretted failing. They all regretted not trying, following what they wanted to do.
I think I'm gonna say Gandhi, but it's probably not Gandhi. But somebody, I just heard a quote literally yesterday that said, failure is a win-win, or something is a win-win. If I do it and I win, that's a win. If I do it and I fail, I've learned.
Yes. Yep.
So it's a win-win. You're either successful or you
win or you learn.
Right.
Yep. All right. Well, thank you, Beth. If people, again, could you remind us, if people would like to find you or connect with you, what should they do?
So Facebook
or Advanced Coding Services,
LinkedIn. I'm Beth Schleeper or Advanced Coding Services. I'd love to connect.
All right. Well, thank you everybody for listening and watching. Thank you, Beth Schleeper, for joining me today. We appreciate you sharing your insights into medical billing and having an impact here in the health industry in Phoenix.
Well, thanks for having me.
Inspired by our guests? Visit PhoenixProsperityPodcast.com/guest and join us on the show and share your success story with Tim. The spotlight awaits.